Hey, I just wanted to give a good patient case example of how simple some interventions can be with functional integrative medicine. So one of my recent patients is a 35-year-old female, and she had a history of chronic constipation. And I've also had some other patients this week with chronic constipation. So constipation is coming up a lot. And some of them would say, oh, it's better because I'm only going every 3 to 4 days now instead of once a week. So if you are not going every day, you have constipation. And if it's not soft and well-formed. So there's that. But, this particular case, there was also hemorrhoids and bloating associated, and also significant anxiety. And so when I think about anxiety, there is definitely a link between the gut-brain axis. There's definitely a link with inflammation. There's also often nutrient deficiencies that can be at play with anxiety as well, hormonal changes, all of those kinds of things. But with this particular person, we had done a stool test as well as some basic labs. So we checked B vitamin status, we checked vitamin D status, we checked CoQ10, magnesium, anemia panel, which also looks at ferritin being low, which is that iron store, can also be related to anxiety. Another thing to think about with constipation is pelvic floor dysfunction. So I talk to patients a lot about how the pelvic floor, and if they've had multiple children, they've had multiple abdominal surgeries, how that can be playing a role. And so pelvic floor therapy can actually be a great tool to use when assessing chronic constipation. This particular person also had multiple antibiotics because they have frequent sinus infections. So that's another trigger in my mind. There's a microbiome issue going on here. If we have multiple, the sinus cavity has its own microbiome, which is playing a role, but then you've also got the microbiome changes from the antibiotics. So that was a lot of what we talked about in the first visit. And then on the stool test, we actually found that she had a parasite. So parasite was present. There were some inflammation markers going on, and so she had the roundworm, and then also so that was seen on our comprehensive stool test, and then also some of higher calprotectin, not high enough to be in inflammatory bowel syndrome, but high enough that there is something going on there. And then also some of the species that are considered normal flora were overgrown. And then we had other species that were not detected. And so there was this imbalance, which we often call dysbiosis in the gut. And so we corrected that by we did do some prescription therapy for the roundworm, because I'm not going to lie, there's some herbal evidence, but if it's me and that was an issue, I would definitely be taking, medications that are clinically studied to remove those. So we did that as a first go around, and then now we're following up with herbs. But the crazy part is she didn't actually start the herbs until recently. When we followed up, she had just done the medication, and anxiety is so much better. And so is a lot of the other symptoms. We're still working and tweaking on some of the dysbiosis pieces, but just treating the parasite made a huge impact in her anxiety. So my message to you, and then there's also the addition of, we didn't do these, the thing about functional medicine is that we don't do all these things in silos. So we don't just do one thing at a time, which can be challenging to know which thing actually worked, because we also addressed some of the low nutrients and, had added a multivitamin with iron. We also had added some probiotics and some other things to address the inflammation in the gut, and calm down some of the inflammation in the gut. So not a one trick situation that was, the only thing that was happening. But it's definitely important to consider the gut-brain axis anytime you're dealing with mental health. So if you're a practitioner listening, especially a pharmacist, we do have a CE program on functional medicine approaches to anxiety and depression. It currently, it's great for everybody, but it is only approved for CE right now over on functional medicine CE. But if you're a patient and you're like, how do I get this type of testing? Please go over to our Farm to Table page and book a discovery call with one of our providers, and you can walk through the process and do the same thing by looking at your nutrient levels, looking at your inflammation, and looking at your microbiome, and seeing if there's something that needs to be treated to be able to actually feel well and balance. And again, there's lots of root causes of anxiety, and the gut is just one piece of it, but it's such an important piece that can't be missed.